You're listening to Innovation for Alpha, where we explore everything at the intersection of healthcare innovation and finance. Through our discussions and interviews, we keep you informed and educated about healthcare innovations, next-level venture investing, and everything involving the combination of the two.
Hi, everybody. This is Tobin Arthur, your host for Innovation for Alpha. And today I'm joined by Dr. Doug Freedberg, who is a really interesting guy, an orthopedic surgeon in Arizona, does very cool things. I'm excited to have Doug on the show and spend a little time with you. Really appreciate your time.
Oh, thank you, Tobin. Pleasure to be here.
Doug, why don't you give everybody a little bit about your background, how you came to Arizona and some of your training, and just give a little context as we get started.
Grew up in New York through high school, then came to University of Arizona in Tucson for undergrad and med school. Then went back to New York, orthopedic residency at the Hospital for Special Surgery in Manhattan. Then followed that up with a sports medicine fellowship down in Birmingham, Alabama with Dr. Andrews, prior to his moving to Florida. And then I've been back in Arizona since 1999. Originally got here because my grandparents were snowbirding and loved the weather leaving New York. So I've been here for, I guess we're on 23 years now, not including the college. So I've been in Arizona longer than New York. Been in practice again since 1999. Started working with a guy in town for the first couple of years. And, reasonably soon I realized it wasn't going to be the right answer. And then my current partner, who we ended up starting our own thing, what happened was we had done internship together. He stayed in Tucson, did residency. I was in New York. We then both did the fellowship together in Birmingham, came into practice in Arizona, different practices, and would see each other every now and again and kind of realize, you know what, let's just do this ourselves. So we kind of, in 2004, started our own thing, Arizona Sports Medicine Center. And the genesis of that, it's grown, and we've gone intermittently from 5, 6, 7, 8 docs and in that kind of number. It's been great. I mean, he and I are very similar. We actually 4 days apart in age, so it's
wow.
I guess I'm senior from that regard, but we're pretty much the same. And it's been great, running our own show and recognizing things that had happened prior. Let's do it differently. I've always kind of took the model of when we're bringing people on, we're going to bring them on as partners and not as people who want to kind of abuse and then have them leave. It's not really been our model at all. We were kind of pretty early on doing combination of orthopedic surgeons and primary care sports, and been into the ultrasound stuff with our non-op guys for years and years, and it's helped out as we kind of developed a pretty good profile out here.
Well, speaking of profile, you work with some pretty high-profile clients. You've got a pretty fun couple days ahead with the Arizona Cardinals Monday Night Football playoffs getting started. Talk a little bit about some of the sports work you do at that level.
Yeah, that should be a fun weekend. Hopefully, it keeps going. It's not our last weekend. The sports stuff started obviously doing training at certain relatively high-profile places. At special surgery, we dealt with a lot of the teams in New York, and then in Birmingham, similar. And then so when I came out to Arizona, interesting, pretty soon, I guess 2-3 months into being here, I was playing in a baseball charity golf tournament, and randomly was paired up with a guy who was doing some work with the Oakland A's. He was one of their physical therapists, and he said, "Hey, do you have any interest in doing some baseball work?" And I said, "Yeah, I mean, hell, I was doing stuff with Andrews and doing stuff back in New York." And interesting, in that same foursome, I was playing with Dr. Lou Yoakum in LA, who unfortunately since has passed, over at Curlin Job. And so I started spring training with the A's in 2000. So I guess rapidly approaching 23 years this upcoming spring training, if spring training happens with the lockout.
Right.
So the baseball stuff has been really cool. And then a couple of years thereafter, this is right around the time where my partner and I, Dr. Wazowski, we started the Arizona Sports Medicine Center. We started taking care of the Coyotes for NHL. And that was very fun. I enjoyed it. The athletes were phenomenal. I'm not a great skater myself, so it's not like I could do that stuff. Whereas baseball, obviously I did. And interesting, at that time, we got asked by the Cardinals to talk to them about taking care of them. And it was really just the two of us as the docs. And then they were correctly concerned. I don't think you guys really have enough bandwidth to do this. You're just taking on the Coyotes. How are you going to be doing this? And they actually went a different direction and told us, oh, we really like you guys, but I don't think this is going to make sense. And then fast forward 3 years later, and they came back and said, you know what? You guys want to do it? So then we talked to them again. And so we've been doing it since, I think, actually right after the Super Bowl. So we did miss that one. We started in 2009 and been doing it since. Wow. And it's been great. So that's been going on. And then a couple of years ago, this was I'm trying to get my year straight here. I think in 2020, we took care of the Phoenix Suns for that season as well. And then as things occur, there's big fish who decide to pay money to take care of some things. So we're no longer doing that, but still enjoy the Suns, and they're doing great. They're a great group. And our office, I'm not doing this, but our office is now have been taking care of the Diamondbacks as well. Oh, wow. I just wanted to stick with the A's and make my life simple. So there's a lot of traffic in the office from different athletes, although obviously the bulk of the practice is still everyday people that we see. But sure. It definitely adds a little level of excitement.
That's pretty neat. So for people not familiar, how does that work? Like maybe just with respect to the Cardinals in terms of how does your time commitment work? Are you going to most of the games? What does that look like post game? Obviously, every game's going to have some injuries. I mean, what's that whole quarterbacking that look like?
In season, it is we kind of try to coordinate things because we have certain days our schedule get a little nutty. So obviously, game day, there's an NFL requirement, 2 orthopedic surgeons at the game. So typically, my partner and I are there at every game. As the years have gone by, the last 2 or 3 years, as my kids started getting a little busier with sports, I've now kind of backed off to some degree and probably cover maybe about 70% of the game. So there's certain weekends I kind of want to chill with the kids. But interestingly, if it's a home game and I'm not covering it, it's actually been some of the coolest games because I can actually go as a dad and take my kids to the game, and it's something you don't see when you're on the sideline. Maybe your kids are way up in the stands. It's not as meaningful as sitting there just being a regular dad, which seems kind of backwards because everybody wants to do the stuff taking care of them, but it's actually more fun when you're in the stands with your kids. So I'm covering the vast majority of games still. So it's game day. We're there 2+ hours before the game, then after the game, checking out the players, then get home. The next day we have our little bump and bruise clinic at the facility. And then another time during the week, typically my partner his schedule works better for this. So like on a Wednesday, then we shoot back down there to see what's going on with them and check out. And then obviously if it's a road game, we're leaving, whether it's the day before, or sometimes 2 days before if we're going way East Coast. And then it doesn't end with the end of the season. And then obviously then you get geared up for Combine in Indianapolis. This will be the last year in Indianapolis, and they're kind of opening up to other cities. But Indianapolis is a 5-day work fest. It's a lot of work seeing 300+ guys where you're kind of doing exams on them and kind of making little medical notes to help out with the drafting. And then there's other meetings, and then the draft in June, and then mini camps and off-season training. So there's really not a huge off-season. I mean, our time commitment is a little bit less during those times, but it's a bit of a 12-month deal. So
that's incredible. So during a game, for example, if people are watching the game and you see the player get injured on the field, and so there's folks out there checking out the player, would you be out there on the field with assuming maybe trainers, or who's out there triaging, and what's that look like?
No, it depends. So the trainers are kind of the first line. They almost always are the first ones to run out there. But if you see something notable, we're out there as well. So just the other, say the Christmas game, we played the Colts, and I don't have my phone with me while I'm on the sideline. It's kind of in the locker room. But and I was out there seeing a player running out there in the field, and I got end of the game, I had like 15 texts from friends who've seen me on TV. A buddy in Nashville calls, "Hey, I finally get to see you for Christmas." So it's kind of interesting. So yeah, no, we're involved in that stuff too. Yeah, no doubt about it.
We talked a little bit earlier, just shifting a little bit instead of the pros, but kids. We were talking a little bit about this issue of injuries in younger kids, and it's personally fascinating to me because I've got kids playing sports as you do. Talk a little bit about that rise of specialization and what that means for injuries in kids. For those who have kids playing sports, I think they'd find this interesting.
I think overall there's been a huge change because it seemed like, and again, I'm 54, to give you a background. So we grew up as kids. You play baseball, you play basketball, you play different sports, and particularly growing up in New York, it gets cold. You're not playing a lot of outdoor sports, so just the weather and seasons change what you're doing with your body in sports. So if you play one particular sport only, your body gets used to that, and there's a lot of compensations that happen. And it's a very wonderful thing for your body to do different sports. The cross training is phenomenal. So obviously, as you go, whether it's just weather and you go out south in Arizona and Texas and in Florida, you have the ability to be able to play 12 months a year. But it's also grown that there's this specialization with coaching where kids are told at super young ages, this is the only sport you can play, and you don't play anything else. And it happens at super young ages, whether it's baseball, whether it's tennis, whether it's soccer. And there's a lot more injuries that happen. And the problem is the parents oftentimes have to get in the way between the coaches who are well-meaning but aren't thinking that their priority is to see how many days Johnny has pitched or not pitched. And you have to separate that, because you really need a time off during a year to allow your muscles and body to relax and rest. As if you're trying to emulate the highest level players, they're taking a number of months off and not continuing to throw a baseball or play football during the off season. So that's really important. And we've seen way too many injuries, whether it's shoulders and elbows in baseball players, whether it's ACLs in soccer, and that's obviously a lot more injury and not overuse. But it's a shame to see how young you're now seeing players. When we were working with Dr. Andrews back in the day, it was the professionals and college kids who were hurting their elbow ligaments, and now you're seeing high school players without a problem. And sadly, because most players do very well with the surgery, it is by no means 100%, but the vast majority do well. They're obviously crazy people thinking, wow, let me just blow up my ligament in high school and then hell, I'll be better and be perfect. It's clearly not the recommendation. So it's sad. It is, but it's got to change, and it's got to be the kids and the parents individually saying, we need to take a break and specialize despite the pressure from the coaches.
Yeah, that's great. One of the things that we love to talk about is, as physicians start to look for some things to do outside of clinical work, and where possible, leveraging their expertise and training, but not always. What are some of the things you found over time? You're in an interesting space with sports, so there's a lot more probably stimulation than maybe some people are used to. There's some fun things that come along, but nonetheless, you found things outside of clinical medicine to plug into. What are the things that have been interesting to you over the last number of years?
Obviously the sports stuff has been great. I love it. I really do. Outside of that, I've been involved for a number of years in some surgery centers that I've been working with. That's been fun. There's 2 of those that have been going on over the years. In the office, I took a fair amount of responsibility. It wasn't anything officially listed, but we kind of dealt with a lot of the financial stuff, and I wouldn't say managing partner by any stretch, but kind of dealt with a lot of that stuff. We had purchased 2 office buildings, sold one, and in the process of considering another one there. So there's a lot of that. I have kind of worked with a number of startups. It's interesting. There's a lot in Phoenix and Scottsdale. There's a fair amount that are there. So some started as crazy as one was. There was a guy, when I was still doing trauma call, I saw his son in the ER for like a wrist or elbow fracture, and then we started talking, and he ends up being a CEO of an orthopedic company, and he asked me to help him out with some prototype stuff. Did that, and He had a couple companies go public, and then it turned into a couple other things. So I've been involved, not at some insane level, but kind of, I'd say, peripherally,
Mhm.
and it's kind of cool. So I like seeing different things. I've always thought of myself as kind of a businessman. I'm kind of the only one in the family in medicine. It's not like I come from a lineage of physicians. So I like that part of it too.
That is cool. On the surgery centers, how did that evolve? Was it just things that you guys were going to build yourselves, or what was the evolution
Yeah,
there?
I mean, the first one is going back probably to about '04, and there wasn't a huge amount at the time in Arizona. There were some, and that was an early one. And other people had told me, "Oh, I don't know, man. I don't think that's gonna be a great idea." And I said, I don't know. I think it's gonna be probably pretty good. You never know for sure, but what the hell?" And that's gone very well. And there was a point at which I think, I don't know, maybe I lose track at the time, maybe about '09 or 2010, a good percentage of that was sold. We're still in the center, but obviously is not as full owners. And then another one was started in about 2012, and that one last year sold to USPI. And it's nice to do things outside of regular day-to-day practice, and also it sure helps from a economic standpoint too. There's so much downward pressure on physicians to not allow you to make money. The insurance companies unfortunately rule the world,
Right.
and it's nice to be able to have a little piece that is outside of their utter control.
How do you find on the time side? Because you've got a lot going on. This weekend's a good example. You've got kids going, here and there for sports. You've got your own, playoff game coming up, and then you've got a practice to run, and on and on and on. How do you find time? And is it maybe it ebbs and flows depending on the season of the year? But how do you squeeze things in outside of
I
the
would
things
say
you're?
step one is try to have a very understanding wife, which I do. She's actually in Las Vegas with one of my other daughters at a soccer tournament, and I'm home with the other two between soccer, basketball, and then I will delay going to the game until Monday morning. I'm going to fly myself separate from the team so I can spend time with the kids Sunday, and then it'll be Monday. So I had to cancel surgeries Monday because obviously during our last game we didn't know what would happen, where we'd be playing, would it be home, would it be away, would it be a Saturday, Sunday, or Monday game. And one of the guys who's scheduled for surgery is a friend of mine, a golfer. And I told him 2 weeks ago, I said, "Hey, listen, I may have to change your schedule surgery because if we have a game on Monday, I'm not gonna be able to do it." So we pushed him 2 days, so his surgery's gonna be on Wednesday, and I had to cancel the whole rest of the day on Monday, and then half a day Tuesday because we're doing the clinic. And then so you got to kind of roll with the punches, and the office staff has been great with that too because they know it happens like that. But in
Mhm.
general, it's and that's why I kind of step back a little bit from covering every single game, because for about 8 or 9 years it was every game, home and away, home and away.
Mm.
And my wife pointed out smartly, interestingly, I said, "You know what, how long do you want to do this for?" I said, "I still really enjoy it. I want to do at least where kids can grow up a little bit and really enjoy it." And then only a wife can say it. She says, "Why do you think it's so fun for him to maybe be in the stands and see you 150 yards down there? He wants to spend time with his dad." And that's why going to the game, sitting in the stands with him, and I've taken one of my daughters as well. Those are some of the coolest days. So I'm trying to
Mm.
find the balance like that.
That's pretty neat. What I was curious too, I was thinking the other day, you must get to know some of these players and you become a trusted resource for them. Do you end up with some of them, they've got family members that have this issue or that? Do you end up getting pulled into, those relationships, or how does that look?
I would say definitely yes. Um, the guy who probably by far takes the brunt of that is the head athletic trainer. He is the clear hub in the whole process. So often he gets a call that somebody's sister or somebody's brother's neighbor has a problem, and we end up taking care of a lot of peripheral people as well. And it's nice. It's no different from you take care of somebody and then their neighbor wants to come in, or you take care of the dad and then the son comes in. So it does flow to family members as well, no doubt about that. And as the years have gone by, it's interesting. When I first started, I was not that far off from the age of some of these guys. When I started with the A's way back in the day, I mean, I was a little older than these guys, but not much. And I was single, and there was a lot of time. And these guys were friends of mine. We play golf all the time and go out. And ended up being, I was at their weddings, they were at my weddings, And now
Cool.
it's interesting to see it. I'm still seeing them in the office, but it's seeing their kids and operating on their kids. It's kind of interesting.
That is interesting. Maybe we'll wrap up. Let's just get a little prediction. So this week you got a big game. You guys have actually had a pretty incredible season. I think came out of nowhere. Most people did not expect the Cardinals to be as good as they were this year, but it's been a great story. What do you foresee this week?
I hope that the team plays as well as they played the first half of the year. It's something where I really look at it and say there shouldn't be a lot of pressure. It's go out and play. This is the one and done. You like it, go play your best and do it. I think we get up to a good start, and that would go a long way towards beating the Rams. Rams are a good team. We're a good team when we play well and don't beat ourselves up. We had a problem last week, but unfortunately so did they. I guess fortunately so did they. And you get ahead, and we beat them in their building last time. So what the hell, one more time.
That's right. Are there any guys on the team, that sort of stand out, that are characters that you end up interacting with more than others? Or is it sort of like you're in and out?
No, they're all a great guy. Everybody has their own personality. They really are. They're great guys. I always have a little pep talk with Chandler Jones before a game and Buda Baker, and there's some great guys on the team, and it's fun. It's fun to be a little small part of the team. It's great. That's
cool. Well, we'll be rooting for you this week, looking for you on the sidelines, hopefully not on the field, because that will mean someone's injured, but we'll like you to be nice and still and just enjoying the game. But Doug, thanks a ton for spending some time. It's been really neat to hear a little bit about your practice. And I think this week we're all Cardinals fans.
That sounds great, Tobin. I appreciate it. You take care.
Thank you. You too.
See you again soon for the next episode of Innovation for Alpha. Make sure to go to Innovation for Alpha for access to prior episode links, show notes, and other valuable resources. This show is for entertainment purposes only. Before making any investment decisions, please consult with a professional. This show is copyrighted by AngelMD Media, and written permission must be granted before syndication or rebroadcasting.